in Australia are offered an ultrasound scan in mid-pregnancy at around 19 weeks. At this scan, the number of babies is confirmed, the size of the baby is measured to confirm it's growing well, and the structure or the anatomy of the baby is checked, and the placenta is imaged to confirm it's in a good location. The Australian Preterm Birth Prevention Alliance recommends that the length of the cervix is measured at all such mid-pregnancy scans. We now know that the length of the cervix between 16 and 24 weeks is predictive of the time of birth. A long cervix predicts a term birth, and a short cervix predicts preterm birth. And if it is short, we have a simple treatment that will reduce the chance of preterm labour. For most pregnancies, the measurement of the length of the cervix can be made as part of the regular scan, imaging through the abdomen in the usual way. With a full bladder, which can make the cervix appear longer, a measurement of 35mm or more is considered normal and reassuring. If the cervix cannot be imaged clearly along its entire length, or if the pregnancy is considered to be at high risk of other reasons, an internal scan will be required. This approach is also known as transvaginal scan. A thin ultrasound transducer is introduced directly into the vagina, providing excellent views of the cervix and lower uterus. The bladder is emptied before such a scan, enabling the true length of the cervix to be assessed. A measurement of 25mm or more is considered normal and reassuring. If the cervix is found to be shortened in mid-pregnancy, you need to be prescribed a treatment as soon as possible, preferably that day. A treatment is usually vaginal progesterone, a simple tablet that is inserted each evening and which will halve the risk of early birth. Your doctor will then arrange further ultrasound scans to confirm the treatment is working and to tell if further steps need to be taken. Routine measurement of the length of the cervix in mid-pregnancy, followed by prescription of vaginal progesterone, is one of the key features of the Australian Preterm Birth Prevention Initiative and is helping to save many babies from being born too early. When you have your mid-pregnancy scan, make sure the cervix is measured, and if it is short, the treatment is started as soon as possible. For further details of this measurement and of Australia's Preterm Birth Prevention Program, go to the link at the end of this presentation. Thank you.